Is your pharmacist so busy that you might get the wrong drug? Stuart Watson and the I-Team reveal local drugstores cited by the state for dispensing drugs at a rate the state calls dangerous.
I went through leukemia as a kid.
Josh Remini started working at CVS as a teenager.
I wanted to get into the healthcare system because I was so fortunate to have people help me.
He became a pharmacist at CVS, worked there for 10 years. But in July, he quit and started his own pharmacy.
Because I felt year after year I was given less and less to do more. And it came down to patient care for me. I couldn't care for the patients that I felt was appropriate.
The North Carolina Board of Pharmacy has a guideline for the number of prescriptions a pharmacist can safely fill in a single day. It's 150. But Josh says sometimes at CVS he filled a lot more than that.
I think I recorded over 500. It's to the point where you feel like you're numb, you're burnt out.
More prone to make a mistake?
Absolutely.
CVS disagrees. A company spokesman emailed us that CVS never compromises safety for speed or volume. The CVS statement says the Pharmacy Board's guideline doesn't take into account the length of a pharmacist's shift, whether the error was early or late in the day, or CVS's billion-dollar investment in automation. But don't tell that to Kay Rayfield.
I think they're in too big of a hurry now.
Last year, she went to a CVS in Gaffney with a prescription for Requip for restless leg syndrome. Instead, she got Wellbutrin, an antidepressant.
Yeah, I said, that's not right. Something ain't right. I said, this medicine's not doing right because it was making me right jerky, jittery, and...
Kay didn't suffer lasting effects, but as a former pharmacy tech herself, she knows the potential danger.
I mean, they could kill somebody.
Last year, a pregnant Salisbury teacher went to the CVS on Ennis Street for an anti-nausea medicine. The pharmacist gave her a drug meant for patients with multiple sclerosis or spinal injuries. The board found the pharmacist had filled 515 prescriptions that day, more than triple the state guideline. The I-Team found the Pharmacy Board cited CVS at least a dozen times in the last 10 years for making mistakes while filling what the board said were too many prescriptions to be safe. 3 times this year alone, at stores in Glen Raven, Davidson, and Huntersville, the board warned CVS about, quote, dispensing prescriptions at a dangerously high rate.
Every chain pharmacy is always volume driven. It's always a stat on how many prescriptions per day, prescriptions per month that you're doing.
In fact, CVS pays pharmacists cash bonuses based on volume. The I-Team obtained this CVS Pharmacist Incentive Update. It compares the budgeted number of scripts from CVS to the actual number of scripts the pharmacist writes, and then it projects how many thousands of dollars the staff pharmacist will be paid if they keep putting pills in bottles at the same rate.
The volumes have increased and the pharmacist hours have decreased. So the numbers are going up, but the hours are going down.
The CVS spokesman wrote CVS pharmacists are not incented based on how quickly they fill prescriptions, but he acknowledges computers track CVS pharmacists and missing deadlines can affect incentive pay. The spokesman wrote, quality health care requires a level of urgency in specific defined circumstances.
It's alarming because their priority is, they're telling you their priority is volume, is to make more money and to do more prescriptions.
CVS also offers incentives for customer service, but at the store we reviewed, more than 80% of the pharmacist's incentive pay came from the number of scripts filled. Stuart Watson, News Channel 36.